Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number 1. The possible outcome and severity of disease is called option A lesion, option B symptom, option C prognosis or option D sign. The right answer is option C, that is prognosis. Actually, prognosis is that possible outcome and severity of disease, while mm, lesion is an area in an organ or tissue of abnormal tissue changes. Lesions vary in severity from that harmless form to the serious form, while pathogenesis is a process of development of disease, and it's include that change of events that leading to that disease. While etiology is that study of causative agents, and if we see that sign and symptoms, that sign is actually objective finding of the doctor on the patients based on analysis, while symptoms is that subjective complaint of the owner about his animal health. That is, the symptoms is person's perspective, while sign based on analysis. Okay. Question number second. Local death of cells or tissue in the living animal is known as option A gangrene, option B necrosis, option C degeneration, or option D regeneration. The right answer is option B, that is necrosis. Necrosis is the local death of cells or tissue in the living organism, while apoptosis is a programmed cell death. And gangrene is the death of the body tissue due to that lack of the blood flow or series of bacterial infections. Gangrene commonly seen in case of arms and legs, and while degenerations and regenerations are the terms which is mainly associated with the nerves injury. When there is nerve injury, either regenerations or degenerations of nerves take place. Here are some criteria for that nerves regenerations, just like a gap between two cut ends should not be more than 3 mm, and the neurilemma, which is the covering of the nerves, should be preserved or present. The nucleus must be intact, and the two cut end should remain in same line. Okay. Question number 3. Due to gravity, blood accumulate in lower sides of body in dead animal, known as option A hyperemia, option B ischemia, option C hypostatic congestion, or option D anemia. The right answer is option C, that is hypostatic congestion. Due to gravity, that blood accumulate in lower sides of the body in dead animal, which is known as hypostatic congestions, while ischemia is a condition which is mainly characterized by lack of oxygen, and anemia is a condition which is mainly characterized by either lack of RBC or lack of blood. And while hyperemia and congestions are the terms both related to that increase the blood volume of the blood within dilated vessels of an organs and tissue. Let's see some basic difference between hyperemia and congestion. If we see that hyperemia is an active process while congestion is a passive process, hyperemia occurs in that hyperemia arterioles dilations take place, while in case of congestion there's impaired venous outflow leads to congestion. And during hyperemia, that affected organ become red or pink in color, and during congestion that affected organ become bluish in color. The causes of that hyperemia is like skeletal muscles become hyperemic during exercise, while causes of conditions like cardiac failure, venous obstructions, etc. Okay. Question number 4. In coagulative necrosis, there is option A, loss of cellular detail, option B, architecture is preserved, option C, both A and B, or option D, none. The right answer is option C, that is both A and B. If we see that necrosis is defined as a spectrum of morphological changes that take place in cells that follow cell death in living tissue. Okay. And if we see that cytoplasmic changes, which include that's increased eosinophil contain, glassy homogeneous appearance of the cells, and vacuolated cytoplasm, calcified dead cells, and appearance of myelin figure. Okay. And if we see that nuclear changes, then we found that cariolysis, cariohexis, and pycnosis. And there are 6 type of necrosis. First is coagulative necrosis. Coagulative, in case of coagulative necrosis, that general tissue architectures is preserved and that affected tissue become formed, and that structural proteins degeneration take place, denaturation take place, and there is enzymatic digestion of cells. While in case of liquefactive necrosis, tissue become liquid, or that materials seems like creamy yellow in color, and it is mainly seen in brain and abscess case. Okay, caseous necrosis is type of coagulative necrosis which is mainly seen in case of TB, characterized by cheesy white depositions in tissue. And if we see that fat necrosis is seen in pancreas, breast. In case of that fat necrosis, activated lipase enzymes cause fat necrosis. And fibrinoid necrosis, there is a deposition of fibrin-like materials seen in peptic ulcer, hypertension case, immunologic cells injury. And if we see that gangrenous necrosis, there are three types of gangrenous necrosis, that is wet gangrene, dry gangrene, and gas gangrene. Wet gangrene mostly occurs in most tissue, that is mouth, bowels, lungs, cervix, and is also seen in case of bed sore. And in this wet gangrene, venous obstruction take place, and which lead to moist, swollen, and dark. And there is no clear demarcations between that healthy and that gangrenous tissue. And bacterial contamination is also sometimes present in case of wet gangrene. And if we see that dry gangrene, it is mainly occurs in extremities like toes, feet, due to arteriosclerosis and sometimes thromboangiitis, trauma, arterial obstructions. And that dry gangrene's affected structure seems dry, shrunken, and black in color. And there is a clear demarcations of between gangrenous part and that healthy part, and there is no bacterial contaminations take place. Okay. And gas gangrene is the gangrene which is mainly caused by gram positive anaerobic bacteria, mainly seen in muscles and colon. Questions number 5. Macrophages laden with hemosiderin pigment known as option A, Gitter cells, option B, pus cell, option C, heart failure cells, or option D, astrocytes. The right answer is option C, that is heart failure cells. That heart failure cells are the macrophages which is actually laden with hemosiderin pigment, and this heart failure cells mostly found in lungs. And if we see that Gitter cells is nothing that is enlarged phagocytic cells, which is one of the form of microglial cells having cytoplasm distended with lipid granules, and it's mainly seen in case of that brain lesions. Okay, pus cells is mainly composed of macrophages and neutrophils to combat infections, and astrocytes is also a type of glial cells which is found in CNS. Question number 6. Collections and examination of tissue in the live animal is known as option A, autopsy, option B, necropsy, option C, biopsy, option D, necrosis. The right answer is option C, that is biopsy. That collections and examination of tissue in the live animal, that is known as biopsy, while autopsy and necropsy is a term which is referred to that postmortem examinations of that dead animals to discover causes of death or extent of disease. Okay. Question number 7. Proteins secreted by lymphocyte on stimulations by an antigen is called as option A, lymphokine, option B, monokine, option C, cytokine, option D, interleukin. The right answer is option A, that is lymphokine. Lymphokine are those cytokine which is mainly produced by lymphocyte, that is T cells of immune system. Okay, monokine are also cytokine, which is mainly produced by monocytes and macrophages, and that has a regulatory effect on function of other cells such as lymphocytes. Monokines includes interleukin first, tumor necrosis factor, alpha and beta interferon, and colony stimulating factor. While that both lymphokine and monokines comes under cytokines. Cytokines is that broad category of a small protein important in cell signaling. Cytokines has been shown to be involved in case of autocrine, paracrine, and endocrine signaling as immunomodulating agent. Okay. Question number 8. Histamine is secreted by an inflammatory cells. Option A, eosinophil. Option B, basophil. Option C, neutrophil. Or option D, monocytes. The right answer is option B, that is basophil. Histamine is secreted by an inflammatory cells, that is basophil. And eosinophils is also known as acidophil. It is a type of WBC which is responsible for combating multicellular parasites and certain infections. Eosinophil are inflammatory cells mostly seen in case of parasitic infestations, allergy, and skin diseases, while neutrophil play a major role in first line of defense. Monocytes is the largest types of leukocytes which is found in blood and is also phagocytic in nature, and it differentiates into macrophages in case of tissue and dendritic cells. Okay. Question number 9. Antibodies or immunoglobulin are produced by option A, lymphocytes, option B, monocytes, Option C, macrophages, or option D, plasma cells. The right answer is option D, that is plasma cells. Plasma cells is a type of immune cells that makes large amount of specific antibody. Plasma cells are developed from that B cells. Lymphocytes, there are a type of WBC, which includes natural killer T cells, B cells. Okay, and monocytes are that phagocytic cells which is found in blood, while macrophages are phagocytic cells which is found in tissue. Okay. Question number 10. When the suppurative inflammation involves the connective tissue diffusely, it is termed as option A, cellulitis, option B, abscess, option C, pus, option D, exudate. The right answer is option A, that is cellulitis. Diffuse suppurative inflammations of connective tissue termed as cellulitis, while abscess is a swollen area within a body tissue containing an accumulation of a pus, and that mass of the cells and fluid that has seeped out of that blood vessels or organ, especially in case of inflammation, that terms as exudate. Okay. Question number 11. Small focal suppurative area in the hair follicle or sebaceous gland known as option A, boils, option B, furuncles, option C, both A and B, option D, none. The right answer is option B, that is furuncles. Furuncles is like skin abscess, which is mainly caused by staphylococcus infections, which involve hair follicle and surrounding tissue, while carbuncles are the clusters of furuncles, which is connected subcutaneously, causing deeper suppurations and scarring. And boils are bump form containing pus under skin as a result of staphylococcal infections developed at site where that skin is broken by a small injury or insect bite. Okay. Question number 12. In TB, type of giant cell seen is option A, tumor giant cells, option B, foreign body giant cells, option C, Langhans giant cells, or option D, none. The right answer is option C, that is Langhans giant cells. In TB, that type of giant cells seen is Langhans giant cells. It consists of that fused macrophages oriented around TB antigens with multiple nuclei, which is located at peripheral positions, representing most successful type of host tissue response. While tumor giant cells is a rare, aggressive, non-cancerous tumor cells, foreign body giant cells includes that collection of fused macrophages, that is giant cells, which are generated in response to presence of large foreign body. While Taunton giant cells are also multinucleated cells having vacuolations in cytoplasm due to high lipid content. Okay. Question number 13. Glycogen in a cell is demonstrated by using option A, PAS, option B, best caramine, option C, iodine, option D, all. The right answer is option D, that is all. The glycogen contained in cell is demonstrated by using PAS, BAST, caramine, iodine stain. Okay, note that PAS is also known as periodic acid chief stain. Is a staining method which is used to detect polysaccharides such as glycogen and mucosubstance such as glycoprotein, glycolipid, and mucin in tissue. Okay. Question number 14. Mucin is stained blue color by the stain option A, Alcian blue, option B, methylene blue, option C, hematoxylin, option D, iodine. The right answer is option A, that is Alcian blue. Alcian blue will color acidic mucin blue, but will not color neutral mucin. To visualize neutral mucin, Alcian blue followed by PAS pass, that is periodic acid chief stain, which is stain neutral mucin magenta color. Okay, cells that have both acidic and that neutral mucin, so dark blue or purple color. Okay, hematoxylins and eosin stains, which are also known as H and E stains, is one of that principal tissue stain where hematoxylin precisely stain nuclear component, and while eosin stain cytoplasmic component, and HNE stain helps to identify different type of cells and tissue and provide important informations about pattern of the cells, shape of the cells, and structure of the cells in tissue. And it is used to diagnose disease, mainly in case of cancer. Okay. Question number 15. Decrease in size of an organ after it has attained its full normal growth is known as option A, atrophy, option B, hypertrophy, option C, metaplasia, option D, hyperplasia. The right answer is option A, that is atrophy. Decrease in size of an organ after it has attained full normal growth, that is known as atrophy, while increase in size of organ due to increase in size of cell, that is known as hypertrophy. Increase in size of organ due to increase in number of cells, that is known as hyperplasia. Change in one form of cells to the another form, that is known as metaplasia. while complete failure of all or part of an organ to develop during embryonic growth, that is known as agenesis, and reversal of that differentiation in cells characterized by pleomorphic cells, extremely hyperchromatic and large nucleus, indicator of cancer. This is the anaplasia, and disorderly but non-neoplastic proliferations of cells, that is known as dysplasia. Note that hyperplasia and keratinization of skin epitheliums occurs in case of vitamin A deficiency. Okay. Question number 16. Continuous inactivity of a part of the body, particularly muscles, results in option A, pressure atrophy, option B, disuse atrophy, option C, exertion atrophy, or option D, physiologic atrophy. The right answer is option B, that is disuse atrophy. Continuous inactivity of a part of a body, particularly muscles, results in disuse atrophy, and that atrophy of that tissue or muscles resulting from excessive pressure applied to that tissue or muscles, that is known as pressure atrophy. And disease related muscles atrophy, mainly characterized by fatigueness of muscles, weakness of muscles, results in exercise limitations and poor quality of life, that is known as exogenous atrophy. And atrophy caused by not using the muscles enough, which is reversed with exercise and better nutrition. Such type of atrophy is known as physiologic atrophy. Okay. Question number 17. The deposition of calcium salt in the local area of tissue which is degenerated, dying, or dead is known as dystrophic calcification. Option B, pathological calcification. Option C, metastatic calcification. Or option D, none. The right answer is option A, that is dystrophic calcifications. Abnormal depositions of calcium salt occurs in any tissue except like teeth and bone, that is known as pathological calcifications, and these pathological calcifications are of two types, that is dystrophic calcifications and metastatic calcifications. Okay, let's see some difference between of this dystrophic and metastatic calcifications. Since dystrophic calcification is the depositions of calcium salt in dead and degenerated tissue, while metastatic calcification is deposition of calcium salt in normal tissue. If we see that calcium metabolisms, which is normal in case of dystrophic calcifications, which is dearranged in case of metastatic calcifications. And if we see that serum calcium level, which is normal in dystrophic calcifications, and hypercalcemia in case of metastatic calcification. And if we see that reversibility, that dystrophic calcification is irreversible, while metastatic calcification is reversible with correction metabolic disorder. And this dystrophic calcification is mainly seen due to necrosis, infractions, thrombosis, and tumor, while metastatic calcification is seen during hyperthyroidism, hypervitaminosis D, and hypercalcemic condition. Okay. Question number 18. Calcium salt in tissue can be confirmed by using a special stain, that is known as option A, von Cosa, option B, alizarin radius, option C, both A and B, or option D, none. The right answer is option C, that is both A and B. Calcium salt depositions in tissue can be confirmed by using special stain, that is von Casa and alizarin radius. Von Casa stain is widely used in histology to detect that abnormal calcium deposit in body. The principle of this coloration is based on transformation of calcium salt into that silver salt. Okay, calcium ions that bound to that phosphates are replaced by that silver ions bound by solutions of silver nitrate. While alizarin as red stain is an earthoquinone dye which is used to stain for calcium deposit, which are indicator of mature osteocytes. Okay. Questions number 19. Cardinal signs of inflammations are option A, rubor calor, option B, Dalor tumor, option C, functionalacia, option D, all. The right answer is option D, that is all. Okay, the five cardinal signs of acute inflammations along with their reasons are as follow. First is redness, rubor, which is due to vasodilations, heat, that is calor, which is also due to vasodilations, swelling, that is tumor, which is due to fluid migrations from blood vessels to the site of inflammations, pain, that is Dalor, which is due to stretching of the pain receptors and nerve by inflammatory exudate and chemical mediator, and that loss of functions, which is due to that pain, disruption of tissue structures, fibroplasia and metaplasia. Okay. Question number 20. Cells comes out through break in blood vessels is referred as option A, diapedesis, option B, pigmentation, option C, races, option D, extravasation. The right answer is option C, that is races. Diapedesis is actually the passes of that blood cells through that capillary wall into that tissue due to increased vascular permeability, while pigmentation is the sticking of that WBC to the lining of that finest blood vessels, that is capillary, when that inflammations take place. And races is that cells comes out from that blood vessels due to rupture of the blood vessels. Okay, extravasation is that leakage of a blood, lymph or other fluid from that blood vessels, lymph vessels or other tube into the tissue around it, mainly seen during inflammations and metastasis. Okay. Questions number 21. Staining of tissue with hemoglobin after death of an animal is referred as option A, algor mortis, option B, livor mortis, option C, rigor mortis, or option D, pseudomelanosis. The right answer is option B, that is livor mortis. Okay. Algar motis the process where there's a postmortal temperature changes characterized by change in body temperature until that ambient temperature is matched. Okay. While livor motis is that discoloration of the body, which is turned into purplish red discolorations as a result of pooling of that blood in body due to gravity and lack of circulation as a result of cessation of cardiac activity. Okay. Rigor mortis is actually stiffening of joint and muscles of the body a few hours after death, usually lasting for 1 to 4 days. Okay, and pseudomelanosis is that dark greenish or blackish postmortem discolorations of surface of that abdominal viscera, resulting from that action of sulfurated hydrogen ions on iron of disintegrated hemoglobin. Okay. Question number 22. Fragmentations of nucleus is referred as option A, karyolysis, option B, karyorrhexis, option C, chromatolysis, or option D, pycnolysis. The right answer is option B, that is karyorrhexis. Karyorrhexis is that destructive fragmentation of the nucleus of the dying cells whereby its chromatin is distributed irregularly throughout the cytoplasm, and then rupture of that nuclear membrane occurs in case of karyorrhexis, while karyolysis is that melting of that nucleus chromatin with enzyme nucleolus released from lysosomes of dead cells. And in this case, that nuclear membrane is preserved. Okay, pycnosis is nothing that is shrinkage or condensations of that cells with high nuclear compactness or density. Okay. Question number 23. In avian inflammation, dash cells are seen in abundance in comparison to mammal. Option A, eosinophil, option B, basophil, option C, neutrophil, option D, none. The right answer is option B, that is basophil. In avian inflammations, basophil cells are seen in abundance in comparison to mammal. The basic of inflammations that is remains same in both avians and mammals. However, there are some differences in reactions in bird. In bird, there is a high permeability in vein, while in mammal, there's a high permeability in case of arterioles and capillary. In birds, during inflammation, heterophil, that is the first line of defense, followed by mononuclear cells, while in mammal, neutrophil is the first line of defense. In mammal, that basophils seen in abundance at site of inflammations, which is a very rare in case of that mammal. In case of birds, perivascular coughing is common, while in mammal, perivascular coughing is only seen in case of brain. Okay, giant cells are seen in both acute and chronic inflammations in case of bird, but in case of mammal, that giant cells are only seen in case of chronic inflammation. In bird, that inflammation is caused by phytohematoagglutinin, which is mainly characterized by skin response with infiltration of heterophil basophil monocytes, while in mammal, no neutrophil basophils seen in inflammations. Okay. Question number 24. Wilm tumor is neoplasm of option A, gallbladder, option B, liver, option C, kidney, option D, lungs. The right answer is option C, that is kidney. Wilm tumor is neoplasm of a kidney. This Wilm tumor is also known as nephroblastoma. Nephro stands for kidney. And that most common testicular tumor of that dog, that is Leydig cells tumor, and Baines Jones protein, that is tumor marker, which is a part of that monoclonal antibody, which is very small and not normally detectable in urine, but it's found in the detectable amount in urine with neoplasm of multiple myeloma, that is bone marrow cancer. Okay. Questions number 25. Mesothelioma originates from mesothelium of option A, peritoneum, option B, pleura, option C, pericardium, option D, all. The right answer is D, that is all. Mesothelioma. Oma means that benign tumor of that mesothelium. It's originate from mesothelium of peritoneum, pleura, and pericardium extra. Okay. Question number 26. Radiation affect the dividing cells of option A, ovary, option B, testes, option C, lymphocyte, option D, all. The right answer is option D, that is all. Dividing cells, which is rapidly growing cells, are prone to effect of radiations. And if we see that radiosensitivity of tissue, then highly radiosensitive tissues includes lymphoid tissue, bone marrow, GI tissue, gonad, embryonic tissue. Moderately radiosensitive tissue includes skin, vascular endothelium, lungs, kidney, liver, lens. And least radiosensitive tissue includes CNS, muscles, bone, and cartilage. Okay. Question number 27. Cloudy soiling is characterized by hazy cytoplasm due to swollen. Option A, endoplasmic reticulum. Option B, Golgi bodies. Option C, mitochondria. Option D, nucleus. The right answer is option C, that is mitochondria. Cloudy soiling is characterized by hazy cytoplasm due to swollen mitochondria. Okay. Questions number 28. Presence of foreign materials in blood vessels is known as option A, thrombus. Option B, emboli. Option C, ischemia. Option D, infraction. The right answer is option B, that is emboli. Emboli is that presence of foreign metals in blood vessels. There are various types of embolis like air embolis, hair embolis, extra. Thrombus is that blood clot which is formed in situ within a vascular systems of body and which impeding that blood flow. Ischemia is a conditions in which blood flow or oxygen is restricted or reduced in part of the body. And infraction is that tissue death or necrosis due to that inadequate blood supply. Okay. Question number 29. Epithelial pulse is an example of dash degeneration. Option A, amyloid. Option B, mucin. Option C, hyaline. Option D, cellular swelling. The right answer is option C, that is hyaline. Epithelial pulse, also known as keratin pulse, which is example of hyaline degenerations, mainly seen in case of squamous cells carcinoma. Okay. Questions number 30. Colilith may cause of dash jaundice. Option A, toxic. Option B, post-hepatic. Option C, pre-hepatic. Option D, hemolytic. The right answer is option B, that is post-hepatic. There are three type of jaundice are seen. First is that pre-hepatic, which is due to that excessive hemolysis. In this case, that unconjugated bilirubin's amount is increases in blood. And if we see that second is hepatic jaundice, which is due to that impaired cellular uptakes, defective conjugations. And in this case, both unconjugated and conjugated bilirubin increases in blood. And the last one is post-hepatic jaundice, which is due to that impaired excretions of bile. And in this case, that both conjugated bilirubin, in this case, that only conjugated bilirubins increases. Okay. That's much for today.